Diabetes is a condition that affects many people, particularly as we age, and sometimes its early signals can be quite subtle. Hello, and a warm welcome back to Senior Wellness. I am Lexi, Senior Health Specialist, your host, and it's always a pleasure to connect with you here. Today, we're tackling a very important health topic, understanding the early signs of diabetes. Diabetes is a condition that affects many people, particularly as we age, and sometimes its early signals can be quite subtle. Recognizing these signs is a crucial first step in managing your health effectively and potentially preventing more serious complications down the road. We'll explore what diabetes is, discuss the common types, with a focus on type 2, which is most prevalent in seniors, and highlight the warning signs that shouldn't be ignored. Our goal today is to empower you with knowledge so you can take proactive steps for your well-being. If you find this discussion helpful, please consider giving us a like. It helps others in our community find this information. And if you haven't already, do subscribe and click the notification bell for more insights on healthy aging. We always value your thoughts, so feel free to leave comments or questions below. Let's begin this important conversation together. Understanding diabetes, what it means for you. At its core, diabetes is a chronic health condition characterized by higher than normal levels of glucose, or sugar, in the blood. Glucose is our body's main source of energy, derived from the food we eat. Insulin, a hormone produced by the pancreas, acts like a key, allowing glucose to enter our cells to be used for energy. When someone has diabetes, this process doesn't work correctly. Either the pancreas doesn't produce enough insulin, or the body's cells don't respond properly to the insulin that is produced. This is called insulin resistance. As a result, glucose builds up in the bloodstream instead of entering the cells. Over time, these elevated blood sugar levels can lead to damage in various parts of the body, including the heart, blood vessels, eyes, kidneys, and nerves. There are a few main types of diabetes. Type 1 diabetes. This type is less common, particularly for initial diagnosis in older adults, though it can occur at any age. It's an autoimmune condition where the body mistakenly attacks and destroys the insulin-producing cells in the pancreas. People with type 1 diabetes require lifelong insulin therapy. Its onset is usually quite rapid, and symptoms are often pronounced. Type 2 diabetes. This is the most common form of diabetes, accounting for about 90% of cases, and its prevalence increases with age. In type 2 diabetes, the body either develops insulin resistance, cells don't use insulin effectively, or the pancreas gradually loses its ability to produce enough insulin. Lifestyle factors like diet, physical activity, and weight play a significant role in its development. Symptoms often develop slowly, sometimes over years, and can be mild initially. This is the type we'll focus most on today regarding early signs relevant to seniors. Gestational diabetes. This type occurs during pregnancy due to hormonal changes affecting insulin use. It usually resolves after delivery, but increases the risk for both mother and child developing type 2 diabetes later in life. While perhaps relevant if you have daughters or granddaughters of childbearing age, it's less directly pertinent to your personal risk as a senior unless you had it during past pregnancies. Why early detection is so important. Because type 2 diabetes often develops gradually, its early signs can be easy to miss or attribute to other factors like aging. However, recognizing these signs early allows for timely diagnosis and management. Early intervention through lifestyle changes and medication if needed can significantly reduce the risk of serious long-term complications such as heart disease and stroke, kidney disease, nephropathy, nerve damage, neuropathy. especially in the feet and legs. Eye problems, retinopathy, potentially leading to blindness, poor circulation, increasing the risk of foot ulcers and amputations. Catching diabetes early empowers you to take control and protect your future health. Common early warning signs, especially for type 2 diabetes. Listen to your body. If you notice any of the following signs persistently, it's worth discussing them with your doctor. Increased thirst, polydipsia, and frequent urination, polyuria. What's happening? When there's excess sugar in your blood, your kidneys work overtime to filter and absorb it. When they can't keep up, the extra sugar is excreted into your urine, dragging fluids along with it from your tissues. This makes you urinate more often and can leave you feeling dehydrated and thirsty. What to notice? Needing to use the restroom more frequently than usual, especially at night. Feeling constantly thirsty, even after drinking fluids? An unusual fatigue or lack of energy. What's happening? If glucose can't get into your cells to be used for energy because of insufficient insulin or insulin resistance, your body is deprived of its primary fuel source. What to notice? Feeling more tired than usual without a clear reason, lacking energy for everyday activities, even after adequate rest. Blurred vision. What's happening? High blood sugar levels can pull fluid from the lenses of your eyes, affecting their ability to focus properly. This can cause temporary blurriness. What to notice? Experiencing intermittent or persistent blurry vision that isn't corrected by your usual glasses. Note, this needs prompt medical evaluation regardless, but can be an early diabetes sign. Unexplained weight loss. What's happening? When your cells can't get glucose for energy, your body starts breaking down muscle and fat for fuel instead. This can lead to weight loss even if your appetite hasn't decreased or has even increased. This sign is often more dramatic in type, but can occur in uncontrolled type 2. What to notice? Losing weight without trying. Increased hunger, polyphagia. What's happening? Even if you're eating, if your cells aren't getting the glucose they need, your body might send signals of intense hunger. What to notice? Feeling hungrier than usual, even shortly after eating. Slow healing sores or frequent infections. What's happening? High blood sugar levels can impair your body's natural healing processes and weaken your immune system's ability to fight off infections. What to notice? Cuts, scrapes, or sores taking much longer to heal than they used to. Experiencing frequent skin infections, gum infections, or urinary tract infections. Tingling, pain, or numbness in hands or feet, neuropathy. What's happening? Over time, high blood sugar can damage nerves, often starting in the extremities. What to notice? Experiencing tingling, burning sensations, numbness, or pain in your feet, legs, or hands. Areas of darkened skin, acanthosis nigricans. What's happening? Insulin resistance can sometimes cause patches of dark, velvety skin, often in body folds and creases like the neck, armpits, or groin. What to notice? Developing dark patches of skin in these areas. In date, recurring yeast infections. What's happening? Yeast feeds on sugar. High blood glucose levels can create an environment where yeast thrives. What to notice? Frequent yeast infections, which can occur in moist areas like between fingers to toes, under breasts, or in the genital area, affecting both men and women. If you notice one or, especially several of these signs consistently, please schedule an appointment with your healthcare provider for evaluation. Simple blood tests can determine if diabetes or prediabetes is present. Taking control, prevention and management strategies. While some risk factors for type 2 diabetes aren't changeable, like age or family history, many are lifestyle-related. Whether you're looking to prevent diabetes, manage prediabetes, or control existing diabetes, these strategies are key. Adopt a healthy eating pattern. Focus on whole, unprocessed foods. Include plenty of non-starchy vegetables, fruits, whole grains, lean proteins, fish, poultry, beans, lentils, and healthy fats, avocado, nuts, olive oil. Limit sugary drinks, refined carbohydrates, white bread, pasta, processed snacks, and trans fats. Portion control is also important. Consulting a registered dietitian can be very helpful. Engage in regular physical activity. Aim for at least 150 minutes of moderate-intensity aerobic activity, like brisk walking, swimming, cycling per week, spread out over several days. Include strength training exercises 2 or more days a week. Exercise helps your body use insulin more effectively, improves insulin sensitivity. Always consult your doctor before starting a new exercise program. Maintain a healthy weight. Losing even a modest amount of weight, if overweight, can significantly lower your risk of developing type 2 diabetes or help manage existing diabetes better. Focus on sustainable changes through diet and exercise. Regular medical checkups, routine checkups are vital for monitoring blood sugar, blood pressure, and cholesterol levels. Screening for diabetes is often recommended, especially for older adults or those with risk factors. Monitor blood sugar, if recommended. If you are diagnosed with diabetes or pre-diabetes, your doctor may recommend regular blood sugar monitoring at home to help you understand how food, activity, and medications affect your levels. Making these lifestyle changes can significantly impact your ability to prevent or manage diabetes and reduce the risk of complications. Understanding the potential early signs of diabetes is a vital part of proactive health management, especially in our senior years. Remember, symptoms can be subtle and develop slowly, so paying attention to changes in your body and seeking timely medical advice is key. Diabetes is a manageable condition, particularly when caught early. By embracing healthy lifestyle choices and working with your healthcare team, you can significantly reduce your risk of complications and continue to live a full and active life. Thank you so much for joining me on Senior Wellness today. I hope this discussion has been informative and empowering. If you found this valuable, please give us a thumbs up and consider sharing it. We truly appreciate your engagement. Please leave your comments or questions below. What steps are you taking for your metabolic health? And don't forget to subscribe and hit the notification bell for more content focused on thriving as we age. Stay informed, stay proactive, and take excellent care of your health. We'll see you in the next video.